So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after let's discuss this test step by step. Her major complaints is fatigue, shortness of breath during exercises, headaches, and difficulty to concentrate. Shortness of breath during exercises is a typical cardiac or anemic symptom. She has a pale skin and pale conjunctiva, which suggests the anemia. Her hemoglobin is 82, which is low. Low hemoglobin we call anemia. And we know that anemia classified based on severity and the size of red blood cells. To determine severity of anemia, we have to know two numbers. It's 110 and 80. Also, in this case, it's a woman. And the lower limit of normal of hemoglobin in women is 120. So, from 120 to 110 is mild anemia. From 110 to 80 moderate, and lower than 80 is severe. In this case, hemoglobin is 82, so it's a moderate anemia. The type of anemia we determine by the size of red blood cells. And to determine the size of red blood cells, we look at MCV. In case of MCV, we have to know two numbers. It's 100 and 80. Everything above 100 is macrocytic, between 100 and 80 normocytic, and lower than 80 is microcytic. In this case, MCV is 68, which is microcytic anemia. So, in this case, patient has moderate microcytic anemia. Once we see microcytic anemia, there are four anemias that come to mind. It's iron deficiency anemia, anemia of chronic disease, sideroblastic anemia, and thalassemia. Among them, the most common ones are iron deficiency and anemia of chronic disease. They both have low serum iron as a diagnostic feature, but the key difference is ferritin. In iron deficiency anemia, ferritin is low, and in anemia of chronic disease, ferritin is significantly elevated. So, in order to say which anemia is it, we have to prescribe iron studies, so it's the correct answer. Bone marrow biopsy will be the correct answer for acute leukemia.